All right, welcome back. I would like to now welcome the panelists of our first panel session of the day, focusing on epidemics and what we are learning from the global response to COVID-19. This topic could not be more important and relevant for the attention of our political leaders, so thank you to CEPI and Wellcome Trust for hosting and supporting this panel session. I would like to now introduce the moderator of this exciting panel, 𝗕𝗫𝐿𝐵fitzgerald. 𝗕𝗫𝐿 is the founder and CEO of Panorama, an action tank dedicated to helping ambitious leaders solve global problems. For more than 2 decades, 𝗕𝗫𝐿 has led teams and collaborated with partners to spark global change. Prior to founding Panorama, she directed the $100 million Ebola program at the 𝗕𝗏 Family Foundation, investing in creative approaches to combat the Ebola outbreak in West Africa. Most recently, in response to COVID-19, 𝗕𝗫𝐿 co-founded the Pandemic Action Network. The PAN advocates for policy changes and increased support and resources to ensure countries are better prepared to prevent, detect, and respond to pandemic threats. So thank you, 𝗕𝗫𝐿, so much for joining us today. I now pass the floor over to you. Thank you.
Thank you, Victoria, and thank you, Ricardo, for putting this great summit together. We're all really excited to have an opportunity to speak to so many parliamentarians around the world on the important topics around pandemic preparedness and what we're learning from COVID to date. So I'll give a very brief introduction and then jump right in because we have a lot to discuss. As Victoria mentioned, I had worked on Ebola, the response to the West Africa Ebola outbreak in 2014, 2015. And coming out of that outbreak, when it came to a close, there were many panels and commissions that talked about what we had learned and what we had needed to make sure that something like Ebola would never happen again. And sadly, there's a phrase that's used in pandemic preparedness called the cycle of panic and neglect. And really, as soon as an outbreak goes away, we enter the cycle of neglect. However, there was one very major initiative that was taken forward, and that was the creation of the Coalition for Epidemic Preparedness Innovation, CEPI. And so we're fortunate to hear from Richard Hatchett today, who will tell us about the progress that's been made with CEPI. And as you'll hear, we've been able to make significant more progress on vaccines because of the existence of CEPI. So there's a lot to discuss. So I want to jump in and ask Dr. 𝗕𝗫𝐵𝗫𝐿, the Director of Pandemic and Epidemic Diseases Department at the World Health Organization, who is going to start by giving us an update on the Act Accelerator, which is a new innovative way that the world is coming together to fight COVID-19. So Sylvie, over to you.
Thank you very much, Gabriela, and thank you very much to the organizers for inviting me. I would like to start to recall that at the end of December 2019, globally, there have been nearly 27 million cases and more than 800,000 deaths due to COVID-19 pandemic. All continents have been affected, but however, the impact is variable. Some countries managed to detect early the introduction of this virus and rapidly suppress transmission, while other countries experienced widespread community transmission with significant impact on health as well as their economies and society.
Sylvie, I'm going to interrupt you for just a minute because we're having very poor sound quality. And so I know you have a lot of important things to share with us. So I want to ask the colleagues at Unite if there's anything we can do to improve Sylvie's sound quality. If not, we may skip you for a moment as that gets adjusted on the back end. Yes.
I'm sorry for that. I tried before.
Yeah,
let me try without the earphone.
Yeah, we're having a very hard time hearing you, and I know you have a lot of important things to say. So maybe we'll let you work with the Unite colleagues on the back end, and I will turn to our second speaker, and we'll come back to you in a few minutes.
Okay.
Thank you. So as I mentioned, CEPI is an important new initiative that has entered the world stage in the past few years. And we're fortunate to have Dr. Richard Hatchett today, this founding CEO of CEPI, to join us. And Richard, if you could share an overview on the state of vaccine development for COVID-19, that would be a great addition.
Sure. Gabrielle, can you hear me okay?
Yes, your sound quality is very good. Thank you.
Okay, great. First, I just want to thank the organizers of the conference today, and certainly the parliamentarians who are participating in the audience for joining. I want to thank Ricardo and Victoria and the Unite Global Board for the opportunity to speak, as well as for the opportunity to work with our friends at Wellcome to coordinate this panel. It's really a great pleasure to be here. I was asked to speak about rapid vaccine development and fair global access, and I think my comments likely would have built on Sylvie's, and hopefully when she's able to sort out her sound quality, you'll see how complementary these are. We have globally, not just speaking about CEPI, but globally, we have developed vaccines more rapidly than we ever have. Because of the interplay of advances in genomic tools, rapid sequencing, amazing new technologies for vaccine development, the ability to provide rapid funding, and that's a role that CEPI has played. I'll talk about that in a moment, and good interactions with regulators. CEPI's role as a Coalition for Epidemic Preparedness Innovation, I won't dwell on this very long, but we did move very rapidly, starting our first vaccine development efforts in January. We now have provided support to 9 vaccines, including some of the most prominent vaccines in the global effort, now the AstraZeneca vaccine, the Moderna vaccine, and a number of other very important candidates. We emphasized speed, scale, and importantly, access in selecting the candidates that we have chosen to support. Our role initially was to accelerate funding to serve as a catalyst to ignite the vaccine development efforts. More recently, we have moved and emphasized ensuring global access to vaccines, because we believe that only if vaccine is distributed globally, managed as a scarce resource, and directed, prioritized for those at greatest need, healthcare workers and those most likely to suffer severe illness and death, will we be able to bring the pandemic under control and ultimately to end the acute phase of the pandemic as rapidly as possible, hopefully by the end of next year. We have also, and I think this is important, I'm going to shift from the technical to talking about the institutional, have also practically overnight created frameworks like the Act Accelerator. Act means the Access to COVID-19 Tools Accelerator. And within Act, the COVAX initiative, which we and our partners at Gavi and at WHO are leading, that allow partners from across multiple sectors to come together in common cause to promote fair global access to, in our case, vaccines. The Act Accelerator is also focused on therapeutics, on diagnostics, and on PPE and oxygen. We have been worried, frankly, about whether COVAX would ignite, whether the self-financing countries would come together or pursue their own bilateral deals with vaccine manufacturers. And we were very concerned that if they did pursue the bilateral deals, we would see a replay of what we saw during the first pandemic of the 21st century in 2009, when a handful of countries, no more than 15 countries, cornered the global supply on vaccine, and vaccine was not made available to the vast majority of countries until after the major wave of the pandemic had come and gone. That would have been a catastrophe given the severity of COVID-19, which is a much more severe and lethal disease than the H1N1 swine flu in 2009. So we were concerned about whether COVAX would achieve critical mass. Last week, we found out we had 80 countries and economies submit expressions of interest. Last week, we asked them to signal whether they would actually participate. 78 said they would. And with the 92 countries provided for by an advanced market commitment that Gavi will administer, COVAX will now provide vaccine to some 170 countries worldwide. That is an astounding display of solidarity in this era of political fragmentation and, frankly, nationalism. Let us hope that we can learn something from this experience. The title of this session is "What are we learning from the global response?" What are we learning from the global response to COVID-19? First, that we had underestimated the impact of a pandemic with even moderate lethality. We have now seen the damage and disruption, the loss of life, the destruction of economic well-being that even a moderate pandemic can cause. We have also learned that we were collectively massively underprepared for the pandemic. Even in a time of global collective crisis, we are still plagued by the demons of politics. And we have learned that where vaccines are concerned, that there are many, many gaps in our preparedness, or there were many, many gaps in our preparedness. At the technical and scientific level, in terms of financing, making rapid financing available, in terms of global manufacturing capacity, and in terms of procurement and delivery. But we are also learning that global collective action is possible where the threats that we face are real and salient. We have seen the solidarity of scientists coming together across the world to work together to understand COVID-19, to share information with each other, and to work rapidly to develop solutions. We are seeing the resilience of societies that have come together during periods of lockdown to protect their most vulnerable members. We are seeing the extraordinary efforts of industry to develop vaccines, therapeutics, diagnostics, and we are seeing, and I think COVAX exemplifies this, the willingness of countries to work together. In COVAX and the Act Accelerator, I think we are seeing new modes of cooperation, something we haven't seen before. Countries working together with NGOs and industry, but largely outside the frame of traditional multinational institutions. WHO is an important partner in the Act Accelerator, a critical partner, but they are part of a larger effort cutting across sectors that has come together. Working together because that is the only way to advance our shared interest in ending the pandemic. I think this is a fundamentally new model, the likes of which only a certain kind of transnational problem will elicit. We have seen this kind of cross-sectoral, all of society cooperation before in individual countries during wartime. We have very seldom, if ever, seen it on a global scale, and we are seeing that now. I think the question, of course, and the question to you as parliamentarians is whether we can sustain the momentum that we have built as we emerge from the COVID era into whatever comes next, and whether we can use that momentum to explore such types of collaboration, call it post-institutional multilateralism, to address other global problems. Thank you.
Thanks, Richard. That's a great way to start the discussion. I do want to try and go back to Dr. 𝗏𝗏 because I do think giving the overarching framework of the ACT Accelerator is helpful for the rest of the conversations. So Sylvie, let's try you again, and fingers crossed it this time.
Okay.
It's still very static. Why don't you try speaking? It's a little bit better.
Okay. So, can you hear me now?
It's okay. It's not very good. Yeah.
Okay. I'm sorry, but I've tried many different headphones and it doesn't work. I don't know what is wrong, but let's try like that. So, tell me if you really cannot hear me. So I just want to, as we started, to highlight the two aspects of the Act Accelerator, because it's a new mechanism, and just to remind us that but in many countries where there has been
Sylvia, I thought that perhaps that would be better, but I think it's quite difficult to hear you. So I think we may need to pause and go to Alex and see. If
I will try later.
Okay, thank you. I do hope we can hear from Dr. Briand because she has a lot to contribute to this conversation, but I also wanted to make sure we could hear what she's contributing. So let's move to our next speaker. I'd like to introduce Alex Harris, who's the head of global policy and advocacy for the Wellcome Trust. And Alex is going to speak briefly on why we have seen so little progress in global preparedness to date and how COVID-19 is creating the case for collective action. So Alex, over to you.
Thank you, Gabrielle. And can I be heard well?
Yes, I can hear you.
Very good. And I'm sorry that we're unable to hear from Sylvia. I'm looking forward to if we can have the opportunity to see what she has to say to us today. So it's great to be here. My thanks to Gabrielle and others, and I'm sure many parliamentarians around the world who've dialed in at sort of unsociable hours of the day or night. But really grateful that so many people are here wanting to listen and learn and discuss about the state of global health. And so it's great to be able to be part of this conversation. For those of you that don't know, very briefly, Wellcome Trust is a UK-based but globally focused foundation that supports science to help solve some of the biggest health challenges that the world is facing. And I think we could all agree that COVID-19 probably is the biggest health challenge that we've faced for a very long time. I want to make a few brief remarks just to talk about why we've seen so little progress in global preparedness, why perhaps some of that is responsible for where we are today, and why it's really important that governments around the world understand the value of working together. So I think there's many reasons why we're here today in a bad situation in many parts of the world. In my opinion, I think lack of preparedness is foremost, and political leadership or poor political leadership comes a very close second. And I want to, at the start of my comments, commend to you the first annual report of the Global Preparedness Monitoring Board. That's if you Google GPMB, you can find their annual report, which was released last September, which the executive summary of which identifies the most urgent actions required to accelerate preparedness for health emergencies. And had many governments and world leaders paid more attention to this report, I think we'd be in a very different place today. The central finding of that report is that the world needs to proactively establish systems to help detect and control disease outbreaks, and it makes the case that preparedness is not something that we should consider as a sort of on an individual country by country basis, actually something that we might refer to as a global public good. And I'm going to make a few comments about why we need to change our mindset in order to be better prepared and invest sufficiently in what you need to be better prepared. And the key for me is, and what I want to say to the people who've tuned into this discussion is, what we really need around the world is leadership. This is a global problem that we're facing, and it needs a global solution. And the question for me is, if some people saw this coming, if some people were calling for the world to be better prepared, why weren't we? And what could we do about it? So we have a number of tools at our disposal and metrics that we gather and calculate that we've used to help us understand how well or poorly countries are prepared for outbreaks of epidemics. But actually, something that COVID-19 has shown us is that those measures did actually quite poorly at predicting which countries would do well and which countries would do less well. So my view, very briefly, is that there are two reasons why we haven't made more progress in preparedness. And they are, as always, money and politics. So although many experts have been raising the alarm about weaknesses in the world's ability to respond to pandemics, even though we had the experience of SARS and Ebola, and Zika over the last 20 years. This clearly hasn't been enough. And the efforts of some countries or international organizations has been relatively fragmented. And as Gabrielle mentioned, this cycle of what we call panic and neglect as countries invest during a response and in the immediate aftermath of a health crisis like Ebola or SARS hasn't actually led to necessarily stronger preparedness for future outbreaks. And many countries say they simply can't afford to invest in preparedness, or don't believe that preparing for pandemics that have a high impact but a low probability should be a priority. And the analogy that I sometimes use is it's a bit like taking out insurance against something that has a low probability but a high impact, and everyone's attitude or risk appetite for insurance is different. And particularly, insurance is something that not everybody can afford, and that's the same for countries as well. But I would argue that this is a fundamental misunderstanding of what you get if you invest in preparedness. So we, organizations like my own and many others in this community, need to make a better case for explaining that what you actually get when you invest in preparedness are stronger health systems that pay off every day, not just paying out when epidemics occur. And the second point I'd make, that's the money piece. The second point I'd make is, and Richard touched on this sort of increasingly polarized world we're living in with a sort of rising nationalism and the sense of some waning support for multilateralism. And this weakened desire to work together and be stronger together, I think, has led to some poor outcomes during this pandemic. Slow decision making from a number of countries, including my own, based in the UK, have, in my view, led to considerably worse health and economic outcomes. So just in my last minute of my comments, I want to talk about what needs to change. So when we're trying to coordinate global response, we need the right money at the right time in the right place to be able to fund these global public goods. So what the Act Accelerator is doing, which Sylvie would have talked about, and what COVAX is trying to do for everyone around the world, is basically to provide equitable access to new treatments for COVID-19. We can only do this in the fastest, most effective way if we have the right funds in place already to invest in global public goods, and we don't at the moment. It's costing us around about $375 billion per month in lost revenue in the global economy. And so we need to change our understanding of investing in order to save in the future. We need to stop thinking of epidemics as just a health issue. It's clearly a whole of society issue. And we need to understand actually that looking after ourselves only may be a route to protecting lives, but not livelihoods. And so I'd perhaps stop there and just say that my message to those parliamentarians who are listening into this discussion is it's really important to back the Act Accelerator. It's important to back COVAX because this is the fastest, most effective way out of this pandemic. And as Richard has mentioned, if we can make COVAX and the Act Accelerator a success, we've provided a perfect proof point for the kind of mechanisms and alliances that we need in the future so that we don't face the same kind of health, economic, and societal impact that we have as a result of COVID-19 so far. Thank you.
Thanks, Alex. Lots to follow up on when we come to questions. I'm going to turn to Michael Weinstein next in hopes that we can have Sylvie as our closing speaker. So Michael is the CEO of the AIDS Healthcare Foundation, and we're pleased to have him joining us at a not great hour. So thank you for joining us in the middle of your night.
Yeah, I'm very glad to have this opportunity to address you. Harvard University's study showed that this outbreak started last August, in August of 2019. And that means that we lost 6 months in responding to this. This is a catastrophic failure of the global public health system. It was a struggle to get WHO to declare a public health emergency of international concern at the end of January. and which we at AIDS Healthcare Foundation asked for. And then in the middle of February, we demanded that we declare this a global pandemic, and yet that declaration was not made until March the 11th. As bad as this is, we can expect to face worse in the future. A genuinely airborne disease of a magnitude even greater than this. I agree with what was previously said about this these efforts being underfunded. It's uncoordinated, and really the current system is beyond repair. There's an estimate that the total wealth that will be lost as a result of this epidemic will be $10 trillion, and yet every year when we're getting funding for various public health concerns, we're really begging for additional support, and that has to change. No system can succeed that is not based upon accountability, transparency, adequate funding, and independence. And none of those things exist now. So the global institutions that are in charge don't accomplish that, and the individual governments have not accomplished that. We have the international health regulations, which is a perfectly fine set of regulations in order to accomplish what we're trying to do. And yet those have not been implemented, and they're not being enforced. Somehow we have to find a way to elevate global public health to a level that is beyond national interest. There are many such things in the world that we do that do not transcend that. In order for bank transfers, there's a rule book for that, and everybody has to agree to that. If we handled air traffic control the way we handle global public health, planes would be colliding in the sky every single day. So many of the things that we consider the most important, we have managed to find a way to overcome or transcend sovereignty. And if we are going to accomplish what we need to accomplish in terms of dealing with this and future pandemics, then we're going to have to find a way to do that. My organization was very involved in Ebola in West Africa. And again, that was another example of what was a catastrophic failure, not on the scale of this, but again, as was said at the beginning, we got into a pattern of once something subsided of neglect. So I'll say that in coinciding with this meeting, we are releasing, in conjunction with the University of Miami, a report based on coming together of 28 people from the political world, scientists, et cetera, advocates, to launch a project of a global public health convention. And I think nothing short of a complete restructuring of the system we have now will protect us. I mean, it's interesting because AIDS, the other pandemic, the one that affected and killed many more people than COVID-19, is a great model. And we have institutions like the Global Fund and like PEPFAR and other institutions which have functioned very, very well. And we've scaled up to caring for tens of millions of people. And we've drastically reduced the impact of HIV. And yet we're not seeing that type of mobilization around this. And I think that, in taking on the issue of WHO as a body and how it responds to these types of issues, it's really not about one institution. It's really not about, it's certainly, at AIDS Healthcare Foundation, we don't agree with U.S. government and the defunding of it, and even scapegoating a particular institution is not the point. But what we have now as 𝗷𝗓𝗄 is so inadequate to the task. And I think, the first step is to accept where we are and to not be in denial about how unprepared We are, and we're not going to get there from here.
Great. Thanks so much, Michael. Obviously, with all of you, there's so many follow-up questions. So we were going to try and go back to Dr. Briand. So let's try one more time. And I understand you've promised if it doesn't work this time, you'll record your comments and we'll make sure they're available to all the participants. So let's try again, Sylvie.
Okay, can you hear me this time?
Yes, yay.
Okay, thanks a lot. So I don't know why it didn't work, because I had other video conference this morning and it worked perfectly, but that's okay. Let's adapt, and I apologize for those problems because it has made you waste time, and so I hope I will shorten a little bit my talk so that we can have enough time for question and answers. So as I started, I was saying that the impact of this pandemic has been variable in different countries, and similarly for individuals. Most of the cases are mild, but individuals with underlying conditions such as cardiovascular disease, cancer, or respiratory disease, and obesity are at risk for severe disease. And some individuals with high exposure, like healthcare workers, as well, at higher risk of having a complication from the disease. So far, there is no vaccine and no specific treatment for COVID-19. And the response has relied on public health and social measures to reduce transmission and protect the vulnerables. Through the R&D blueprint and the solidarity trials, WHO has coordinated early research efforts to develop vaccine, diagnostic, and therapeutics, but also studies to better understand the virus and the disease. But it's not enough. And this is why, together with a number of partners, the Act Accelerator has been recently launched. So it was launched at the end of April 2020, at an event co-hosted by the Director General of the WHO, the President of France, the President of the European Commission, and the Bill and Melinda Gates Foundation. The Act Accelerator, or Access to COVID-19 Tools Accelerator, brings together government, scientists, businesses, civil society, and philanthropists, and global health organizations such as the Bill and Melinda Gates Foundation, the CEPI, FINE, Gavi, Global Fund, Unitaid, Wellcome Trust, the World Bank, and the Global Financing Facility. So it's truly a global partnership to try to end this pandemic. So these organizations have joined forces to speed up really achievement of public health goal by supporting the development and equitable distribution of 4 tools or life-saving intervention: the test, the treatment, the vaccines, and other health products, such as PPE, personal protective equipment, and oxygen. And this global partnership is really what the world needs to reduce mortality and severe disease. In the near term, not only it will have achieve public health objectives, but also it will help to restore the full societal and economic activity globally. And in the medium term, it will facilitate the control of COVID-19 disease should the virus remain with us for a long time. So how does it work? Firstly, it's important to highlight that the Act Accelerator is an end-to-end process. It starts upstream with the research on new products, then the acceleration and the scale-up of production, then the rapid procurement, and downstream the delivery at country level. The second point, which is important, is that this broad partnership aims at leveraging the capacities and assets of each partner. The work, and it's a complex work, has been organized in 3 pillars: 1 pillar for vaccine, 1 pillar for diagnostics, and 1 pillar for therapeutics. And there is also a health system connector that will ensure effective deployment of tools and safe delivery of health services, as well as the supply of personal protective equipment for health workers and oxygens for countries who need it. Third point is that while in normal time we have a sequential process for research, manufacturing, procurement, and delivery, here the ACT partners decided to use an accelerated and parallel work streams to rapidly achieve the goals. So for vaccine, the goal is really to accelerate development and safe and efficacious vaccine, and to ensure access to 2 billion doses by the end of 2021. So as Richard mentioned already and other speakers mentioned, a new mechanism has been created for vaccine. It's called the COVAX facility. And now, as of Friday last week, 78 high and upper middle countries have now confirmed they will participate in the COVAX facilities. The COVAX facilities aim at really maximizing the chance for each country to get the best vaccines. Because as you know, currently many countries have started to develop vaccine candidates. Over than 120 vaccine candidates have been proposed across the world, and WHO is tracking them on a daily basis. And 34 of these candidates have now entered clinical trial. But we don't know yet which product will come first and how efficacious and safe these first products will be. So thanks to the COVAX, it will be possible for vaccines entering in this facility to maximize their chance to have the best vaccine and minimize the risk to invest in vaccines that at the end will not be either safe or efficacious enough to control COVID-19 disease. As we have said before, no one is safe until everyone is safe. And this is why WHO has developed a framework for fair and equitable allocation that has been shared with member states for comments. This document also includes a description of a mechanism to ensure equitable allocation of vaccine, focusing on public health goals. And the mechanism, the development of other mechanisms for therapeutics and diagnostic is under development. Why have we done this? Because we know that at the beginning there will be a scarcity of resources. And we know from previous experience of pandemic that the risk is that the poor will be served at the end and will have the leftover of what other rich countries don't want to have. So this fair and equitable allocation framework try to address this problem and increase solidarity and equity related to the distribution and allocation of COVID-19 tools and products. And again, for vaccine, the aim is not to vaccinate the entire population of few countries, but to vaccinate the more vulnerable in all countries in the world, because this will change the epidemiology in the near term. And as Winnie said, it's not only a moral imperative, but it's also the best way to protect the entire world. The mechanism that has been developed through the COVAX facility will ensure not only timely access of scarce products, but also the best way to allocate vaccines so that we can reduce mortality in the largest number of countries. For therapeutics, the aim is to identify new and more effective treatments and to catalyze the manufacturing, procurement, and delivery of successful candidates. Recently, you have seen that the dexamethasone has proven to be useful for severe patients, and we look at new treatments such as monoclonal antibodies and antivirals also to help to reduce mortality and to treat patients affected by COVID-19. The goal is to ensure that 245 million courses by mid-2021 will be available. And for diagnostic, the aim is to identify rapidly game-changing new diagnostics and also bring affordable and high-quality rapid diagnostic tests at scale to the market. And the target is 500 million tests by mid-2021. So as you see, Act Accelerator is ambitious. It's a groundbreaking way of working, but it's still work in progress. It's based, of course, on global solidarity, and this partnership, bringing together many partners, really aims at strengthening and joining forces to achieve our goal more rapidly. So we count on everyone to support the Act Accelerator initiative. And thank you very much for your kind attention, and sorry again for the technical problems.
Great. Thank you, Sylvie. I'm so glad we got to hear you because it's such an important topic. So just to organize ourselves, we'll have about 20 minutes of discussion among the panelists, and then we'll be able to do 15 minutes Q&A from the audience. And we are getting the messages via social media, so don't hesitate to reach out that way. So first, Sylvie, I think the most important question for the parliamentarians in our audience is, if they are hearing about COVAX and are interested in having their country sign up, what process do they need to go to? And that might also be a question for Richard as well. But Sylvie, why don't you start?
Yes, sure. So COVAX, as I earlier mentioned, has been really spearheading by the Gavi, but of course with the support of CEPI and WHO. And so countries and parliamentarians can go to the Gavi website, where there are the forms to enroll or to participate in this COVAX facility. And also they can have access to more material and be able to ask questions through this channel.
Great. Richard, would you like to add anything?
Sure. No, just to maybe amplify a little bit of what Sylvie has said. The COVAX facility, we have released essentially the terms and conditions under how the facility will operate. Those can be examined. The timelines, I think I just want to mention, as I said on August 31st, we asked countries to indicate whether they will participate. That does not, if a country is not participating, and there are only a handful that aren't at this point, but would like to, the next deadline and the important deadline is actually September 18th, which is coming up in about 10 days, and that is a time when countries will make a binding commitment to participate in the COVAX facility. So we have received indications of the intent to participate. The binding commitments will come on September 18th, and the down payments, which are described in the terms and conditions and explained there, will be due on October 9th. So things are moving rapidly, but they have to move rapidly. We have to move at pandemic speed, and we're all having to operate much more rapidly than we certainly would do under ordinary circumstances.
And Richard, given the financial commitment, are those conversations being driven by the treasury or finance ministries in countries, or does it vary?
I think it varies country by country. In some cases, it's Ministry of Health, and in many others, it's treasuries or ministries of finance. Gavi is also, just to underscore, within the COVAX facility, there are two funding streams. There are self-financing countries buying vaccines for themselves, and we have set up an advanced market commitment that will use overseas development assistance, or ODA funding, that will be provided hopefully by donor countries to support the procurement of vaccine for lower income countries. And there are 92 countries that are eligible under the advanced market commitment. Gavi is talking with its board about how that AMC will work financially, and there'll be more information issued about that in coming weeks. Over.
Thanks, Richard. While we have you, we've started to get questions on social media about timing questions. So when will a vaccine be available, kind of at a baseline level, and then when will manufacturing be able to be scaled? And obviously, we're seeing news reports that vaccines are already available. Could you speak to that?
Sure. I have to say that the question of when the vaccine will be available is probably the question that I have been asked most often since January. Starting back in January, when we were initiating our vaccine development programs, we aspired to deliver vaccine within 12 to 18 months. So really meaning in the first half of 2021. We have been fortunate both in terms of the number of vaccines, as Sylvie mentioned, that have entered clinical trials to date. The number, I think there's 8 or 9 vaccines now in phase 3 clinical trials. We are anticipating it is possible that we would be getting safety and efficacy readouts from those trials as early as later this year. So in kind of the November, maybe early December timeframe, which might, depending on the regulators, might facilitate whatever the local equivalent of emergency use authorization is. We are not anticipating full regulatory licensure for any vaccines before 2021. And I would suspect that vaccine would not become broadly available outside of this emergency use, which would be very restricted, I think, in most countries until sometime in 2021.
Thanks, Richard. And speaking on the emergency use, and Sylvie, going back to your reference to the equitable distribution framework, can you talk a little bit more about that? So what does that mean? Have certain populations been identified? How would decisions be made about which country would access the vaccine first?
So currently, the discussion has been more on how, when we have scarce resources, which population do we target first so that we can immediately reduce the mortality and reduce the risk for vulnerable population. And so we have identified, as I mentioned earlier, that healthcare workers who are at the front line and more exposed, but also very much needed to take care of patients, and also people with underlying condition would benefit more from the vaccine at the beginning. But having said that, we understand also that there is no one-size-fits-all. Each country has to face different dynamic of the pandemic. And so we will have to wait first to have products available to see indeed if those high-risk groups are really the best group to target first. And secondly, see each country if this makes sense really, depending on the dynamic of the pandemic at this point in time. And currently, most of the discussion are a bit theoretical in a sense that we don't have a vaccine yet. We don't know which product will come first. And the characteristic of the product will also influence the way we want to allocate this vaccine. For instance, if we have a product that requires ultra cold chain, for instance, we might want to use this product in certain settings rather than in other settings where this capacity is not yet available. So currently, there is still a lot of things that needs to be further defined when we have more clarity on which product will be available. But what is important is that the principles of fair allocation will be driven by public health needs, and also will take into account specific vulnerabilities in different countries. And so all the partners agreed on those principles as well as member states, and this is what will drive a fair and equitable allocation.
Isn't there a question of trust?
Yeah.
I mean, as to how many, I would say in the current environment, a very large percentage of people would be unwilling to take it. I mean, when you have scientific studies under a heading of warp speed and some of the other things, but also when you have a Russian vaccine that is approved before it's even gone to phase 3. I mean, I think if there is not a centralized scientific body that's authoritative and that can really speak to the safety, I think, in my opinion, the speed is less important than getting it right. And I think that is too much focus on the speed, and I think it's going to be to the detriment of the acceptance.
Thank you, Michael. Sylvia, if you could speak to that, and there's also there's obviously the questions and distrust around the speed, but also there's been increasing anti-vaccine sentiment, which I know is something WHO has focused on. So if you could speak to how you're thinking about that.
Yeah. So first, within the Act Accelerator, what is planned is for the first, the allocation mechanism. We think that fair allocation requires transparency. So transparency on the product, the availability, but also transparency on the safety and the efficacy of each product. So the transparency will be at the core of building this trust for among countries and population. And secondly, obviously, what we try is to accelerate normal processes that usually are slower just because there is less emergency. But acceleration doesn't mean that we will not make sure that products are safe. And at least within the Act Accelerator and the COVAX facility, there will be an independent body in charge of this allocation, and they will certainly look at those aspects as well. And this independent body will be composed of high-level scientists and technical people who can really assess not only the type of product, but also the safety of each product. Having said that, it will be certainly not enough to build the trust, because trust, as you know, is something that is take long time to build, and it's easy destroyed by misinformation or disinformation. And so that's why we have also put in place a plan to communicate better about those products and answer the concern of the population, which are legitimate actually, because I think many of these vaccines are based on new technologies as well. So it's normal that people are anxious and question the safety of those products. But we are really working very hard with a number of partners to provide the right information at the right time and in the right format to those populations.
So Richard, anything you want to add? And then I want to switch topics a bit.
No, I wanted to come back to the point that Michael made about transparency and accountability. I think, and Alex may even want to jump in on this. I mean, we have already seen a number of instances where declarations have been made, emergency use authorizations extended and then retracted or qualified. And the global vaccine enterprise absolutely depends on the confidence of the public. And I would just say I've been very encouraged by the partners in industries that I have spoken with, who feel adamantly that we all understand why we are accelerating vaccine development or efforts to develop therapeutics or diagnostics. But the companies are also, really staunchly in support of demonstrating, through well-designed clinical trials, safety in particular and efficacy before vaccines are released. And I think we are all in alignment with that. There is, unfortunately, we don't need to go into it, but there is unfortunately a history of effort to deliver vaccines rapidly that haven't ended well. And we need to be mindful of that history, and we need to be absolutely committed to demonstrating safety to the highest scientific standard.
Thanks, Richard.
Yeah,
Please go
Can
ahead,
I just
Alex.
add, I know you want to move us on, but just a couple of things, because I think it does strike at the heart of what I believe a lot of members of the public, a lot of governments, a lot of parliamentarians are hearing, talking about, and thinking. I think it is really important to understand that it's unlikely that there'll be one vaccine that works well for everybody. So this isn't just going to be, which is the first one that gets over the line and shows sufficient efficacy. I think we are likely to need more than one vaccine. It's important that people understand that. Secondly, I think it's our experience in the past is that the first vaccines aren't always the best. And what that doesn't mean that we're going to come out with a vaccine that isn't good enough. But what it does mean is that, to my earlier point about not having one vaccine that works for everybody, we need to not get carried away about the first one or the first two. We actually need organizations like CEPI, which are backing a broad portfolio of vaccine development efforts to make sure we have multiple vaccines that get to the point where they can come to market and get regulatory approval, because that will enable us to have a much more effective impact. But the last thing I wanted to say is, and it gets to, I think, what might be behind some of what Michael's talking about, is that governments will be in a tricky spot when we get the first vaccine that comes through, because they will need to make decisions, and this is what politicians are there for, is to balance that trade-off between health and economic benefit. Because we could wait for a very long time until we have a perfect vaccine, and we could in the meantime incur significant economic costs to the global economy, which would have a real impact on people's livelihoods and detrimental to societies. Equally, it would be bad to rush out a vaccine that was only sort of 50% efficacious, or whatever that level might be. So there is a balance to be struck there. And I always encourage people on this call and who are having conversations with as part of their governments to be thinking very carefully about that, because there is that trade-off, and we will find ourselves in a scenario which is not something we have experienced.
Alex, I wanted to bring in a question from the audience, from the Ghana, a colleague in Ghana, who's the Unite Chapter Chair for Western and Central Africa, who asked Michael to please elaborate on your comment that Ebola started in the August of 2019, and the impact that if we had better preparedness mechanisms in place, how we should have caught that and warned about that earlier. And then I do want to spend a few minutes on the broader preparedness question.
I was saying not Ebola, but COVID. The Harvard study said that it can be traced back to August. There were 8 dissidents in China who were interrogated and told to keep quiet. But I want to say that we should not look at a vaccine as a magic bullet. Okay, I think this is really important. Okay, first of all, it will not be 100% effective. That's number one. Number two is, if it fosters complacency, we've seen this with AIDS treatment. Now that AIDS treatment is widely available, we have a problem with prevention. Okay, so if we look at a vaccine as a get out of jail free card, okay, we're going to be really in trouble. So the public health measures, the testing, the contact tracing, the identification of the hotspots, the therapeutics. Just like with HIV, it was a cocktail that wound up being the solution, right? So we need to think of this as a multifactorial thing. The same thing with TB, right? Again, I think that this idea that a vaccine is going to save us, and the last thing I'll say is, other vaccines that have had problems, those problems were not revealed within weeks of when the Guillain-Barré syndromes and other things like that. It took a while. So I think the point about it is that, and also, even with all the discussion now about scaling up manufacture before it's approved, whatever, we're going to be living with this in much the way we are now for another year. Okay? And I think that there's, most of it from my country, just too much loose talk about, that vaccine is going to make this whole thing go away. Or even economically, I don't think it's going to be a magic bullet.
Thanks, Michael. I want to go to beyond vaccines, other preparedness measures that could have been put in place. And Alex, you mentioned the report of the Global Preparedness Monitoring Board, and you suggested people go back and look at their first report. What were some of the things that were recommended that would have, if they had been enacted, we would have been better prepared for COVID?
Yeah, thanks, Gabrielle. I'm very happy to just briefly talk about so the executive summary, which is a good, quick read, concise, lays out 7 sort of urgent areas where the world needs to focus on to be better prepared. And I'll just briefly go through some of these and give you some quick thoughts. So the first one is that actually it requires political leadership at the top. So heads of government the case needs to be made and bought into that, even, as I mentioned, even if your current mindset is it feels like insurance and it's something that I could potentially decide not to take out because it's low probability but high impact, you need to invest. And you should invest because actually, if you do, you're going to reap the benefits every day by having a stronger health system. So it's understanding that we're not just talking about specialized capabilities that only really give you a return on investment when something big strikes. It's actually about having stronger health systems. So we need to get away from the sense that these are really highly technical, highly specialized things that are difficult to make the case for to your finance minister, because if they just stand there and nothing happens for a few years, then the interest will wane and it won't be sustainable. So these things pay off. Secondly, you need the political forums of multilateralism that we have to work well. And actually, I would argue that they haven't worked as well as they've needed to in this response. And we could be in a very different place today had the G7 and the G20, to give 2 examples, taken, as we say, the bull by the horns and really wrestled this and tackled this challenge and committed to collaborative endeavor and collective action. And the Act Accelerator is now that vehicle that we're pointing governments to and say, please, although we can't get the G7 and the G20 to get sufficient consensus to back it themselves, many of the members of those political fora believe in this, have put their money where their mouth is. Thirdly, that these multilateral institutions need to be prepared. And I'm not going to get into the politics of kind of World Bank pandemic bonds and things like that, but I think it has been clear to everyone who's kind of sufficiently aware of this that actually mechanisms that were put together intended to pay out and provide the funds in response actually didn't do it quickly enough, and also hadn't really foreseen an event like this. And so what we need are institutions, multilateral financing institutions, to be sufficiently capitalized so that they can make these funds rapidly available for global public goods. So yes, of course, making sure that individual countries that have the weakest health systems get cash quickly, but actually to all the things that we need, whether it's a vaccine, whether it's more effective tests or cheaper tests or scaled up manufacturing of therapeutics, that money is difficult to raise. And we know because my organization and WHO and CEPI and many others have been trying to do this. And the truth is we've raised really about less than 10% of what we need. And that speaks to the lack of existing mechanisms. And actually the amounts of money we need are not huge compared to what governments have already spent on economic stimulus packages. They're just not spending it on the thing that would actually bring this pandemic to the fastest, most effective end. And that's, again, an issue of mindset. And then maybe the final thing I'll say, I won't go across kind of all 7, is actually about how we incentivize investing in this area. We've got a couple of, as I mentioned, a couple of different indices and tools and regulations that we have, but actually implementation of those international regulations has not been good enough. And we need a bit more teeth behind that to not necessarily enforce, but reward investing in preparedness. And if we can find a way of doing that at relatively little cost, then I think we'd be in a much better place next time around.
But how difficult would it have gloves and masks in every country? I mean, that's not expensive. I mean, these are simple things that why can't we educate people about hand washing? I mean, all the time. I mean, I just say to the parliamentarians who are coming from poor countries, carve out whatever amount of money it is. We had the same issue with PPE for Ebola. I mean, that's just a simple and easy thing we can do.
Michael, I did want to ask you, you mentioned you had this new paper coming out today with some recommended changes. How do your recommendations differ than those of the Global Preparedness Monitoring Board? And then Sylvie will go to you next. And I also want to remind people to send in questions. So Michael.
I mean, again, it goes back to every time there's a pandemic or an outbreak, we convene multiple expert panels. Okay, they come up with a list of recommendations, which are basically promptly ignored. Okay, the fundamental problem is the structure. Contributions should not be voluntary. Other things that the world cares about, they tax countries. Okay, an institution like the WHO, which is basically run by 193 members rather than any kind of executive structure that can act quickly. I mean, we have to start from scratch to say, okay, what would a system look like that gave the importance to public health and to pandemics that we give to air traffic, to trade, to banking transfers, to atomic energy? That's where we should start, is something that, and so in all of those areas, we ask governments and they willingly give up sovereignty. That's what we have to have if we're going to make a fundamental change.
Thanks, Michael. Sylvie, please go ahead.
Yeah, no, I wanted to complement what Alex said, that what is also very important with preparedness is the sustainability of investment. And we have seen, for instance, since the adoption of the pandemic influenza preparedness framework, that since 2012, sustainable funding through the partnership contribution, mainly the industry, has supported this investment in preparedness. And this has enabled us to strengthen the global influenza surveillance and response system, which include 131 laboratories in the world, and many of them are in developing countries. And this is thanks to this network that now many countries have the capacity of testing. So I think it's very important to sustain the investment. It's not only after the pandemic to invest in preparedness, but really make sure that there is a fund that covers those investments for at least 5 or 10 years. Otherwise, I mean, if it's just one-off investment, it doesn't work, because behind this, what we need is really to have a global workforce to respond to a pandemic, and developing this workforce takes time. And it's not only buying material, buying PPEs, but you need also to make sure that people know how to use PPE and how to treat severe cases of respiratory disease, for instance. So it's a long-term investment and sustained investment that is needed.
Sylvie, could you talk, since we probably have parliamentarians from many different countries on the line, for the influenza surveillance system you just discussed, can you talk about how that relates to investments in other surveillance systems that might have caught COVID earlier?
Yeah, I think this surveillance system has been initially built for influenza, because influenza, influenza viruses are constantly circulating. And so this system is a global system that allows us to collect influenza viruses throughout the year. And this monitoring of circulating influenza viruses allow us also to determine the composition of the seasonal influenza vaccine. So this system is for monitoring of viruses, but also allow for early detection of new viruses. And so it's an alert system also on emerging viruses for influenza. But what is important with this system is that we work with countries, we strengthen their capacity. Also, there are different training and training materials that are shared through the system, but also reagent for diagnostic. And so it's a really a network of laboratories that allow the world to better detect and also better monitor emerging viruses. And so it's very important.
Can I ask why did it fail?
This kind of system.
Why did it fail to detect COVID-19? The system that you're referring to.
This system is built for influenza. And so that's why now we are expanding it for COVID-19. And many countries have now merged their influenza surveillance with COVID-19 surveillance.
Oh, but I'm saying, but
it didn't fail because
similar. The two are similar. So wouldn't you have picked it up?
The virus very, very early on, and many countries are now this capacity also to sequence viruses very quickly. And I think this is a major progress compared to what we had in the past pandemic.
No, what I'm saying is, if it's an early warning system for influenza, and the symptoms are so similar with COVID, why would it have picked that up? Why didn't it pick that up?
Well, usually when the system, so I think the Chinese picked that up with initial cases in Wuhan because they have a surveillance system built to detect a cluster of unexplained diseases. And so this is what happened in December 2019. Because as you rightly said, it's very difficult to differentiate on the clinical symptoms, the difference between flu and COVID.
But it was circulating for months before that. Okay, I'm sorry, apologize.
So thanks, Michael. And it sounds like we should definitely look at the Harvard paper you reference. Just being mindful of time because our panel did start a little late due to the last panel running late, but I'm sure the organizers would like to get back on track. I just want to give each of the panelists maybe 30 seconds to give a final wrap-up comment on, the topic is what are we learning from this response? And I guess as you think about what we've learned, what do you want the parliamentarians in the room, the virtual room, to take away and take back to their countries? And I'll go in reverse order from the way I see you. So Michael, would you like to go first?
We have to have a system independent, accountable, and robust enough to prevent this from ever happening again on this scale. And I think that we can't have change around the edges. We have to have fundamental change, and that means money, it means the accountability, it means the independence. That's what I think is the bottom line here.
Thanks, Michael. Sylvie?
Yeah, I think what we have learned is that even when countries are prepared, and some countries were not really well prepared, so we definitively need to increase national preparedness. But for pandemic, we really need a global preparedness. I mean, mechanisms that allow us to work together, to coordinate efforts, and to make sure also that when products are available, they can be shared equitably among all the countries that are affected.
Thank you. Alex?
Yeah, thank you. So I think what we've learnt and what we need to act on is that this is not just a health issue. It's not just about lives, it's about livelihoods. And secondly, it's not just about looking after your own citizens. Actually, if you want to stabilize and return your economy to growth, then you need to make sure that the pandemic is ended everywhere. And therefore, the importance of collaborative action, working together and ensuring that everybody in need, in greatest need, has access to these interventions at the same time is actually enlightened self-interest. So the funding of the Act Accelerator is absolutely critical because it's the best way to achieve that.
Thanks, Alex. And Richard?
I would just build on the comments that have been made by saying I do think we need new systems, but I think they're going to need to be at multiple scales. I don't think all of the solutions are within governments. I think we need to look hard at the components of the response and think about how they have served us and not served us well. To the parliamentarians who are participating today, I would say that one of the major failures, and I think Alex highlighted this earlier, was the availability of financing. And I think we now are experiencing the consequences of not having those financing arrangements in place in advance, robust, and able to respond rapidly. So as parliamentarians, I would urge you to look at how governments, which are going to be where the financing needs to come from, how governments can best work together to create a system that protects us in the future.
Great. I want to thank all of the panelists. I know we had a few technical difficulties at the beginning, but I think we were able to get most of the points out. There is clearly a lot to discuss, and maybe I will just end and try, instead of trying to summarize, because we did cover a lot of ground, just end by following up on something Richard said in his earlier comments about what we are seeing in the response to COVID is a new type of multilateralism that's bringing together a very wide range of stakeholders. And in that context, I want to really thank Ricardo for his leadership in putting the Unite network together, because having parliamentarians active in these global debates and in fora where they can learn and network and participate outside of their own specific country is so important as we try to face these global issues that do not stay within country borders. So I want to really thank the Unite organizers. We would love to have more time because there's more to discuss, but I think this is a great start to a conversation, and we'll turn it back to you, I believe, to take the group into a break. Thanks so much.
Thank you all so much as well. It was really an engaging and important panel session. So I thank you, Gabrielle, for moderating this incredible panel. I thank you so much to our colleagues at CEPI and Wellcome Trust and AIDS Healthcare Foundation and the World Health Organization that made this possible. And so I will now transfer us to a break. As Gabrielle said, we were a bit delayed from the previous opening session, and so we will delay this break only by 15 minutes. And so in this break, I do encourage you all to continue tweeting and to continue submitting questions for our speakers. Again, all of the panel sessions do have question and answer included. So I thank you so much for participating in this first panel session of the day. We do have a few more to go. And I will see you all back here at 11:30 local Lisbon time. So that's just 10 minutes from now. Thank you so much.